Madi Vanstone is a 12-year-old girl and a force to be reckoned with. Madi's living with cystic fibrosis and is taking a drug that, although expensive, has dramatically improved her life. Madi and her family are fighting with OHIP to get OHIP to cover the cost of the drug. And as Pam Seidel tells us live tonight, the battle is ongoing. Pam?
That's right, Gord. Representatives from Vertex, the company that manufactures the drug Kalydeco, came up from the States hoping to make a deal with health ministers from Ontario, Alberta, and the Yukon. And while negotiations are ongoing, Madi's life is still in limbo.
I'm stunned. I'm just stunned. I'm so disappointed. I really thought we were going to have some positive news out of this.
Beth Vanstone is crushed that a meeting to hammer out a price for the drug Kalydeco ended with no concrete results. The drug is still not covered by provincial health plans. Kalydeco has been life-changing for her 12-year-old daughter Madi, has transformed her little girl, who was desperately sick with cystic fibrosis a year ago, to one who is now perfectly well. So much so that a month after starting the drug, she tested negative for CF.
I'm just a big ball of worry right now because I feel so good right now and I don't want to go back to where I was before.
This is what we've been hoping for since she was diagnosed at 8 months old, is a cure. And this is basically a cure, and now we're being told that she can't have it.
Kalydeco costs about $350,000 a year. That works out to close to $500 per pill. Why so much? Well, it's exorbitantly expensive to research and develop any drug. But because this one benefits such a small population, just 118 people across Canada, that drives the price way up. Madi's family pays for it right now with a combination of fundraising, a discount from the drug company Vertex, and private insurance. But that might end in June, so time is of the essence. 15 other countries have managed to make a deal with Vertex. Madi's mother wants to know why not Canada.
Like, this is my daughter. Like, she means everything to me, and her health means everything. And you know what? There is enough in this country to make sure that everyone has drugs. There's nothing else available to do what this drug does for her.
Deb Matthews wasn't at the meeting today. A Ministry of Health staffer came instead. Time is of the essence for a lot of patients. How close are you to making a deal? Will there be a deal sometime in the not too distant future?
Well, we don't know the answer to that question conclusively today. I think what we're asking, and I think what all Canadians are asking, is why should Canadians be asked to pay more than the best price in the U.S.?
The drug company is still hopeful a deal can be reached.
The proposal that we put forward is as good or better than any proposal in the 15 countries that are reimbursing Kalydeco worldwide.
And someone who is also hopeful, strong, and eternally positive is Madi herself.
All I can say is it's not discouraging me, and it's actually making me stronger, and it's making me angry, and I want to fight more now.
So cute. Without Kalydeco, Madi's prognosis is grim. She would likely have to go on a waiting list for a lung transplant in her teens and faces an early death, likely in her 20s. As long as she stays on this drug, she can expect to live a long, normal life.